Hi, this is Dr. Joel Singer. As you heard before, I am a retired plastic surgeon. Was in practice for over 50 years. Tremendous amount of experience. For the past 12 years, I've been doing my own research in the field of stem cell therapy and alternative therapies. I'm here to tell you about some secrets, maybe not so secrets, but my own personal secrets about how I take care of myself and how I've looked at my health in the past few years. As some of you may know, I'm going to be 81 years old. I think I'm in pretty good shape, and I want to stay that way. So how do I do that? Well, let's move on with it. So there's a lot of evidence in the scientific literature that stem cells can actually have a very, very beneficial effect on inflammation. And as you know, inflammation is probably the root cause of at least 70 different chronic diseases. Now, everyone here has probably heard of the immune system, but most people don't understand how can the immune system attack yourself. Well, that's what autoimmunity is. The immune system actually ends up, by mistake or by some other mechanism, attacking your own tissue. And depending on which tissue is involved in this attack, that's the symptom, that's actually disease you're going to manifest. So autoimmune disease is kind of a generalized malfunction, but when it hits your nervous system, it's one type of disease. When it hits your blood system, it's another type of disease. When it hits your kidneys, it's another type of disease. When it hits your joints, it's called by a different name. So let's go through some of these autoimmune diseases and be more specific. This actually is a study that was done on at least 3 or 4 different types of autoimmune diseases, where they used a stem cell infusion of adipose-derived stem cells that were expanded. So they had large quantities. And they were actually studying lupus, which is an autoimmune disease that attacks the blood vessels, it attacks the kidneys, it causes all kinds of problems. And they wanted to see whether or not these people would benefit. And so they organized a study. It's a small study, but yet, it did reveal some pretty good information. And first of all, it showed, number one, that this is a safe procedure. There were little or no adverse reactions. And number two, there were some benefits. So I think a study like this, which is small and on a very small scale, has to be expanded, has to be more of a controlled double-blind type study in order to be valid in the scientific literature. But still, it's a valid study. They did the homework. Now, this is a study using umbilical cord stem cells treating multiple sclerosis, or MS. MS is a very serious autoimmune disease that attacks the nervous system. Actually, it seems that the immune attack is on the myelin sheath, which coats the nerves. It's almost like an insulator. And if you destroy the myelin sheath, the nerves don't function properly. So anywhere in the body where this disease attacks the nervous system, that's the symptoms you get. So anyway, this paper discusses taking a group of patients with MS and giving them large dose infusions of umbilical cord stem cells, mesenchymal stem cells. And quite interestingly, there were definite benefits, especially in the immune function. In other words, in the inflammation function, inflammatory effects. Lowering inflammation improved pain, improved some of the symptoms, improved numbness, and in fact, there were some MRIs that actually showed decrease in disease in the brain, as a result of these infusions. So of course, I can't extrapolate from a small study and say this works and this is great for everybody. But again, this just leads us to believe that this study should be continued and there should be more studies like this. This was a study that actually I observed because it's taking place in New York City. And this is the TISH study where they took mesenchymal stem cells, actually bone marrow cells, and they expanded them in culture, and they also stimulated these cells to become nerve progenitor cells. And then these cells were actually given intrathecally, that's inside the spinal canal, in patients who had MS symptoms from the waist, mostly from the waist down. And this has been ongoing. It has been, at least 2 years in the running. It's a phase 2, and now I think phase 3 study. This is very significant because they did get improvement in function. Obviously, if you have serious damage, it's going to be much more difficult to restore any function in a patient like that. But in these cases, there was some restoration of function, which is very hopeful. Again, the small study has to be expanded. We need more information, but again, it's pointing in that direction where we can see the benefit. Now, this was a study where they used adipose-derived stem cells to treat inflammatory bowel disease, which is IBD, which is also ulcerative colitis or Crohn's disease. And in fact, one of the products that's already been approved, at least by the European Union, is an adipose-derived stem cell product used for fistula in Crohn's disease. And that's been approved. It's one of the first adipose-derived stem cell products that's been approved. It's still, I believe, in phase 3 in the United States, hasn't been approved yet. But over 2 years ago, if you want to get this treatment, you have to go to Europe, France, Italy, England, and they have it there. And so that's very hopeful because it's a product that's being used for a treatment for a very serious and debilitating disorder related to an autoimmune disease. So there you go. Rheumatoid arthritis. Rheumatoid arthritis is when your immune system attacks the lining of your joints. And any joint can be damaged from this process. It's an inflammatory process in the joint. There are medications that have been useful in the treatment of this very serious disease. However, the medications long-term have some serious side effects, especially where it shuts down the immune system and you're susceptible to more, infections. So there has to be another alternative treatment, and that's actually where, people have been looking with stem cells. And again, the inflammatory process in the joint actually is improved with an infusion of stem cells. So in any event, the point I'm making here is that, first of all, I personally have suffered from a form of autoimmune disease, and I have taken upon myself to have certain treatments that have helped me a tremendous amount. And again, I'm not prescribing anything for anybody else. I'm advocating for knowledge and people to learn about this. But this is what I did for myself, and I've been very satisfied with the results. I wish these treatments were more readily available, and people didn't have to travel, and people didn't have to spend a tremendous amount of money. I think that's another thing that I would hope for. But in any event, these treatments are helpful, they work, and there are many people that can benefit from this. And that's what I have to say today. Thank you very much.